Living with bipolar disorder can feel like emotional whiplash, extreme highs, exhausting lows, and everything in between. And when addiction is also in the picture, that roller coaster becomes even harder to manage. Hi, I'm Jacob Christenson, CEO of Radix Recovery here in Cedar Rapids, Iowa. If you or someone you love is struggling with bipolar disorder and substance use, I want you to know we understand how complex this is, and we have real, effective treatment options that can help. People living with bipolar disorder often turn to drugs or alcohol to cope with the swings, whether it's trying to calm down during manic episodes or escape the hopelessness of depression. Over time, that coping mechanism turns into a second disorder. It's a pattern we see often, and it's why dual diagnosis treatment is so essential. You can't treat one without addressing the other. Dual diagnosis care means we treat both conditions at the same time in a fully integrated way. That's the only way long-term healing can happen. At Radix Recovery, we work with clients who experience manic episodes, increased energy, racing thoughts, risky behaviors, depressive episodes, intense sadness, isolation, suicidal thoughts, and mixed states where both happen at once, creating intense emotional chaos, and co-occurring substance use disorders that develop from trying to manage these symptoms on their own. We help you understand what's happening, why it's happening, and most importantly, what you can do about it. Our program starts with a thorough mental health and substance use assessment to get a full picture of your experience. From there, we build a personalized treatment plan to stabilize your mood, manage cravings, and help you build the foundation for lifelong recovery. Treatment may include cognitive behavioral therapy to challenge distorted thinking patterns tied to both addiction and mood shifts, dialectical behavior therapy for emotional regulation and impulse control, relapse prevention planning, customized for the triggers that are unique to bipolar disorder, individual therapy, where you'll explore the root cause of addiction, trauma, and emotional dysregulation, group support, so you can connect with others navigating similar challenges. Everything we do is built around helping you find balance, structure, and real peace of mind. If you've tried treatment before and it didn't work, it could be because only half the problem was being treated. Treating bipolar disorder without addressing substance use can lead to constant relapse. Treating addiction without stabilizing mood means you're left vulnerable to the next episode. You need a plan that respects the full complexity of your experience, and that's exactly what we offer at Radix Recovery. There's a lot of misunderstanding about bipolar disorder, and when you combine that with addiction, the stigma can be heavy. But let me be clear, you are not a problem to be fixed. You're a person to be understood. At Radix, we don't lead with judgment. We lead with clinical expertise, real compassion, and a belief in your ability to recover. If you're tired of the mood swings, the substance use, and the chaos that seems to keep coming back, it's time to try something different. Call Radix Recovery today to schedule a free assessment with our team. We'll help you understand what's really going on and work with you to create a treatment plan that actually works. You deserve stability, you deserve support, and your recovery starts here.